What happens with untreated cancer? Okay, this is a question I feel really stupid asking. My question is, what happens if cancer doesn't get treated? For example, I had a colleague who died from colon cancer. It wasn't a diagnosis he expected. He didn't have bad symptoms and felt healthy overall. Then, after he got the diagnosis and chemotherapy was started, he got miserable really fast and died only about 6 months later while being in an awful condition. Of course, chemo is exhausting for the body, so that explains why he didn't feel good, but also the explicit symptoms of his disease got worse so fast. In the end, he died of multiple organ failure, I think. I sometimes wonder how it would have gone if the cancer was never detected. Would he have been healthy, or at least not realizing there is something really wrong for a longer while? Would he have been in a better condition before and when he died? Is there a possibility it wouldn't get worse? It's not only his case. I also saw others whose symptoms got really worse once the cancer got detected and treated. I'm just wondering, because you'd think a disease would get better if you treat it. I mean, I know that chemo is no walk in the park, but I thought that the symptoms would still get better, even if the overall reaction of the body might be pretty dreadful. I just couldn't imagine my colleague dying 6 months later when I last saw him at work. He seemed so fine. Thank you all for your answers.
Dying from untreated colon cancer is brutal and unbelievably painful. My mom did this, and the only treatment she got at all was when they had to remove most of her colon and give her a stoma and ostomy bag. The cancer spread very quickly throughout her whole body. From diagnosis of stage 4 to death was 6 excruciating months. She was given so much morphine, I'm shocked she was conscious much of the time. She wished she wasn't when she was, though. Eventually enough of her organs were so cancer-ridden that they started shutting down, and her heart gave out overnight finally. She was 5 feet 6 inches and overweight, but weighed less than 80 pounds at death.
They used to call breast cancer the stinking disease. As the cancer grew, it made its way to the skin. Then it would break through the skin and the flesh would basically rot. Because it was an intimate area, many women even into the 1950s wouldn't seek help. There was also a strong belief that it couldn't be treated. So women would just live with it because they feared being separated from their families to have surgery, which seemed more likely butchery, which they didn't think would help.
Cancer grows exponentially. Once it's detected, it's often quite advanced. Cell doubling time gets faster as it grows. Cancer cells crowd out regular cells. They suck up nutrients and grow in organs and bone. They spread through the lymph system, so the body start retaining fluids. The time span for treatment versus non-treatment with some cancers isn't all that different. Doctors try to buy time, but it is true that the time bought is not always quality time. There's supposed to always be a QOL assessment with any treatment offered, but patients always overestimate hope and underestimate side effects. What is better? 3 months where you're somewhat miserable, or 6 months where you're more miserable? The answer might be different if you're hoping to see a child married or have a baby. Some chemo is like having the flu a few days every 3 weeks. Is 2 bad days worth 19 relatively good ones? There's always the hope of the miraculous response. Palliative care has also made death less horrific. My parents talked about people writing in pain and lingering for months. That sort of passing is less likely to happen in a world with a full suite of painkillers, steroids, anti-nausea meds, and other supportive measures. Grief makes us really uncomfortable. Anger is a much more comfortable emotion than sadness. So when someone dies, one of the most common reactions is to blame someone. Anyone. Doctors and nurses are very used to this anger being directed at them.
My expertise is childhood cancer. My child died to brain cancer while actively being treated with little success, and I have met way too many families whose children died both in and out of treatment. Some had no treatment options from diagnosis. None of them died good deaths. I described here what they often look like before death, but I deleted it because it is too gruesome. The only peace they had was thanks to medical intervention. Death was typically from organ failure, but a few died to viruses due to no immune system. One mercy was if the cancer was not visible on the outside of their body. When it would grow out of their mouth or eye socket, it was absolutely horrific to see. It was a clear visual to the devastation going on inside the body. These tumors can grow measurably by the day. The few adults I know who chose not to treat their cancer because they did not want to suffer through chemo came to regret it as they were dying. If you are diagnosed with aggressive cancer, burn it, poison it, cut it out. Get it out of your body as fast as possible. You are not sparing yourself misery by ignoring it. At least with treatment there is a chance, and treatment is advancing every day.
My dad had a rare form of liver cancer. He lost weight and was always tired, and his legs had become really skinny. It was too late for treatment, and it spread throughout his lymphatic system. His kidneys had stopped working and told us he felt very cold. He also began to stop speaking. The doctors told us he didn't have much time, and they gave meds to help alleviate the pain and help him with passing.
To anyone who needs this, please do not give up. Get treated. We are rooting for you. Leave a comment if you have any feedback. Drop a like and subscribe for more videos like this one. Take care. Ingat.